Thank you very much, Mark. It's a real honor and pleasure to be here this morning and to see lots of familiar faces and also to see lots of new ones. Working on this issue has been a real pleasure, and I want to thank Mark for the opportunity to work on it. I want to thank Lynn for being a very close colleague and partner in shaping and developing the issue, and I want to thank all of the editorial staff at AJMC for all their incredible work in helping to assemble the issue. I also want to thank the authors who did just an absolutely terrific job in shaping and framing the discourse that we're going to have today. Today you'll hear perspectives from a variety of different types of stakeholders: health plans, the federal government, the patient perspective, the academic and research community's perspective, and what you'll see is that health information technology is really changing the clinical practice of medicine and changing the way in which healthcare is delivered to patients today. Mark gave me the honor and the pleasure to introduce to you a man who probably needs absolutely no introduction to this audience, Dr. David Blumenthal. David has been a mentor to me over the past year, and I've had the honor and the pleasure of sort of learning at the feet of a master, I would say, and watching him really transform the discourse around health information technology in this country. When he was named national coordinator, there was this vague concept that was stipulated in the legislation, concept that we're all familiar with, which is meaningful use. And David had the important task of helping to shape what meaningful use would really represent and how it would transform the healthcare delivery system in the United States. And watching him do that and watching him sort of win the hearts and minds of physicians and clinicians throughout the country as it relates to health information technology has been a special treat for me. I've just learned so much. So I want to introduce you all to Dr. David Blumenthal.